Shall we start the section? Shall we start? A very good afternoon, everyone, and welcome to this revision section of your upcoming exam. My name is Savina, and I will be your host for today. We are here to ensure that you feel confident and prepared as you tackle these important subjects. Throughout this interactive section, we will revisit key concepts and address any questions you might have. Before we begin, let's go over a few quick guidelines. Please keep your microphones muted unless you are asking a question to avoid background noise. Feel free to use that chat feature to post your queries or thoughts during the section. We encourage active participation, so don't hesitate to speak up if you need clarification. Thank you all for being here, and let's make this a productive and insightful section. Without further delay, let's dive into the topics.
Good afternoon, everyone. So today we can discuss the syllabus and important questions from child health nursing. So we are having 7 chapters in child health nursing. We can go through one by one. Am I audible?
Yes, ma'am.
Okay. Okay. First, we are having the introduction chapter. In this unit, you are detailedly studying about the modern concept in child health, trends in pediatric nursing, and what are the role of a nurse in caring a child, the concept of preventive pediatrics, and the vital statistics. So we can discuss some topics from this unit. So the first one is trends. So what are the trends in pediatric nursing? Trends in pediatric nursing? Any idea? Okay, the trends are family centered care.
Excuse me?
And second, I will repeat. Yes, ma'am.
It's not audible actually. Yeah. Yeah, once again you can tell.
Is it audible now?
Yeah, yeah.
So, okay, we are discussed about the trends in pediatric nursing. Once again, I will tell you the trends. First one is family centered care. Next, high technology care, evidence based practices, child oriented environment, and cost containment. These are the trends in pediatric nursing. So, moving to the next topic, that is preventive pediatrics. What is preventive pediatrics? Ma'am, you're having any idea?
Yeah, the preventive pediatrics is mainly focusing on promoting the health by preventing the diseases, right?
Yes, it focuses on preventing illness and promoting healthy lifestyle in children. So, for promoting health, the preventive pediatrics is providing nutrition counseling, physical activity promotion, and sleep guidance. And for preventing diseases, the preventive pediatrics is giving vaccinations, injury prevention, and infection control. To avoid injuries, the preventive pediatrics giving health education to the parents so that the injuries will be prevented in homes and playgrounds. Okay, moving to the next topic, that is vital statistics. Let's discuss one by one. The first one is infant mortality rate. So what is infant mortality rate? So it's the number of death of infants under 1 year of age per thousand live births. In thousand live births, the death of infants are calculated. That is the infant mortality rate. Next is the neonatal mortality rate. So it's the number of death of neonates under 28 days of age per thousand live births. In thousand live births, how many neonates are dying? That is neonatal mortality rate. Next one is under 5 mortality rate. So what is under 5 mortality rate? So it's the number of death of children under 5 years of age per thousand live births. In thousand live births, how many children under 5 years are dying? That is under 5 mortality rate. Next one is birth rate. It measures the number of live births per thousand population. In thousand population, how many births are occurring? It's the birth rate. So that's all about your introduction chapter. So moving to the next unit, that is growth and development. So in this unit, we will get a clear idea on the changes that happening to a child during his or her developmental period. So what is the difference between growth and development? So what's the difference between growth and development? Any idea? First one is growth. So, growth refers to the physical changes occurring in a child. What are the physical changes occurring in a child? Height, weight, size, head circumference. These all are the physical changes. It is a quantitative change. We can measure the height, weight, and size. So, it is a quantitative change, and growth refers to the physical changes. Moving to the development, it is a qualitative change. It can't be measured, like cognitive, emotional, and social abilities. These are the qualities of a child. It will be improving with time.
Excuses, it's not audible. Hello?
Is that audible?
Now it's audible.
So that's the main difference between growth and development. Growth means the physical changes occurring in the child, like height, weight, or size, like that. In development, the qualitative changes are occurring, like cognitive skills, emotions, language, memory, communication. So that's the main difference between growth and development. Moving to the next topic, that's the stage of growth and development. So, what are the stages in a child? Ma'am?
So that stages are starting from infancy to adolescence, right?
Yeah.
As infancy, toddler, and last the adolescent.
Yeah, that's the stages. Am I
Hello.
audible? Am I audible?
Yes,
Okay,
yes.
that's the main stages in the development of a child. First one is infancy, school, and adolescence. Next, moving to the very important topic in this unit.
So, what is breastfeeding? Any idea? Breastfeeding.
You can share the answers.
Okay. It's the process breast milk directly from the breast or expressed. So, it's a feeding a baby with breast milk direct from the breast. So, there are some benefits for baby and mother in breastfeeding. So, we can check what are the benefits to baby and mother. So, first one is optimal nutrition. Breastfeeding, the baby will get all the nutrients needed for the growth and development. Second one is boost the immune system. The breast milk contains all the immunoglobulin that the baby needed. So the immune system will support the baby growth. Next one is promote digestion. The milk is in fluid state so that the digestion will be easier. Next one is supports brain development. The breast milk will help the baby's brain development. Next one is improves cognition. The milk improves the cognition and memory. Next one is improves immune system. These are the things I will tell you. The immune system promotes health. Next, the benefits. So, what are the benefits for mother? If you know the answer, mean you can tell. Benefits for mother. So when breastfeeding, the uterine contraction will increase so that it will return to its pre-pregnancy size. Next one is supports weight loss. By giving breast milk, weight will be reduced in the mother. Next one reduces the risk of breast cancer and ovarian cancer. By giving breastfeed, the mother will get less chances for breast cancer and ovarian cancer. Next is enhances the mother to child bonding. By giving breastfeeding, the mother to child bonding will be increased. So, that are the benefits for mother and baby by giving breastfeeding. So, these are the important topics from this unit. So, that's all about this unit. Breastfeeding and growth and development will be an important question to your exams.
So moving to our next unit, that is the sick child. So in this unit, we are studying about the revision section of your academic exam. Fear and anxiety, and next is resistance and denial. Resistance like anything, and they shows the peak level of tantrums at the time of hospitalization, and they will shows withdrawal and silence. Some child may shows silence because they don't want the treatment, so they show some silence and withdrawal. Next is the aggression and anger. They show aggression and anger towards their parents as well as to the healthy workers. So they show fear and anxiety, resistance and denial, crying and tantrums, withdrawal and silence, aggression and anger. Is that clear? Is that clear? Hello? Is that clear? Okay, moving to the next. How you will manage such situation as a nurse? How you will manage such situation? So as a nurse in such situation, you can openly communicate with the child. And next is the emotional support. You can provide emotional support to the child and family members. And you can give comfort measures to the child. What you can do? You can give some toys, showing some cartoons, music. So this will encourage the child and improve the cooperation. And this question may ask for 5 mark as a short note question. And next is the pediatric resuscitation. So what is pediatric resuscitation? So what is pediatric resuscitation? Pediatric resuscitation. So the pediatric resuscitation, it is a critical intervention for children who are unresponsive, not breathing, or in cardiac arrest. So the pediatric resuscitation is a critical intervention for children who are unresponsive, not breathing, or in cardiac arrest. The goal of pediatric resuscitation is to restore adequate circulation, oxygenation, and ventilation to prevent neurological damage and death. So it's an important question. So please note down the definition. Once again, I will repeat. Pediatric resuscitation is a critical intervention for children who are unresponsive, not breathing, or in cardiac arrest. The goal of pediatric resuscitation is to restore adequate circulation, oxygenation, and ventilation. Okay. So next is the steps of CPR. So ma'am, what we have to do in the first step?
And we have to call for help.
Yes, first is we should call for help. We should activate the emergency system in the hospital setting. First step is the call for help. Next is the check the airway, breathing, and circulation of the baby. We should assess the airway, breathing, and circulation for any blockage. So next is the chest compression and rescue breathing. Immediately after assessing the airway, breathing, and circulation, we should start the chest compression and rescue breathing. For 30 compression, we should give 2 rescue breaths. Using your thumb and finger, you can give the chest compression, and using the bag and mask technique, you can give the breathing. Soon after that, you should assess the vital signs of the baby, and until the baby shows a positive sign, you should continue the CPR. Is that clear? Is that clear? I will repeat
Yes,
once again. The first step is call for help. First step is call for help. Second is check the airway, breathing and circulation. Third one is start chest compression and rescue breathing in the ratio 30 is to 2. And last is continue the CPR until baby shows a positive sign. Clear?
clear, ma'am.
Clear,
Okay.
ma'am.
So this is about your this unit. Don't forget the definition of pediatric resuscitation and the steps of CPR. Note the ratio CPR, that is 30 is to 2, and the method is thumb and finger method. You can give the compressions using thumb or using the fingers. Okay. Okay. Next, moving to the next unit, that is disorders and health problems of a child. Disorders and health problems of a child. Hello, am I audible?
Audible, ma'am.
Hello. So we are moving to the next unit, that is disorders and health problems of a child. So in this unit, we have briefly explained about the health problems in the infancy, childhood, and adolescence. So what are the health problems in infancy? Health problems in infancy. Any answers? Hello? Any answers? Disorders in infancy. Hello? Any answers? Hadi, are you there?
No, ma'am, tell me.
Okay. There are some health problems in infancy. Ma'am, you know the answer?
Yeah, ma'am, diarrhea, vomiting. Then the important one is failure to thrive.
Yes, that's it. The already you know diarrhea and vomiting. What will happen? This child may have serious dehydration. Serious dehydration. As a result, there may be chances for the baby may die also. Next is the failure to thrive. So, what is failure to thrive? Failure to thrive. So, the term failure to thrive describes a child who is not gaining weight or developing at a healthy rate, mainly because of inadequate nutrition, medical conditions like gastrointestinal disorders, respiratory problems, or genetic disorders, and maybe infection and neurological disorders. So, failure to thrive is a condition where the child who is not gaining weight or developing at a healthy rate. Clear? Is that clear? Okay. So, the next disorder is, ma'am, can you please change the slide? Okay. So next is the disorders in childhood. So the disorders in childhood includes communicable diseases, general medical conditions like tonsillitis, otitis media, and some behavioral disorders like nail biting, thumb sucking, and nutritional problems like protein energy malnutrition, and eating disorders like pica and tics. So in this unit, we are detailing studying about these conditions. So let's discuss some important questions. So the first one is breath holding spasms. Anyone know the answer? What is breath holding spasms? Breath holding spasms. Breath holding spasms. Hello? Hadi, Nidin, Anisha, you all are there?
Yes, madam, we are hearing. Yeah, we are
Yes,
listening
ma'am.
the topic. Yeah.
Okay, okay. So I explain what is that. So the breath holding spasms, also known as breath holding attacks. So when a child is too much stressed, or if the baby is too much frustrated, at that times what happens means the baby holds the breath and go into an unconscious state. Okay, the baby go to an unconscious state, so the baby's color become blue. So that is what breath holding spasms. Clear? I will repeat once again. Breath holding spasms, also known as breath holding attacks, are episodes where a child stops breathing and may lose consciousness, often triggered by emotional stress or frustration. Sometimes this question may ask us the 2 mark question and 5 mark question. That's why I again repeated that one. So the next condition is protein energy malnutrition. So it is a condition characterized by a lack of essential nutrients, which include protein and energy. So This protein energy is very necessary for the growth and development. The protein energy malnutrition is a condition where lack of nutrients, protein and energy is lacking. Okay. So there are some types of protein energy malnutrition that are kwashiorkor, marasmus and marasmic kwashiorkor. Clear? Kwashiorkor, marasmus and marasmic kwashiorkor. So the next condition is pica. So what is pica? What is pica?
Pica is a habit disorder. Eating unsubstantiated.
Yes. Yes, very good answer. It is an eating disorder characterized by persistent craving for non-food substances such as hair, chalk, sand, like that. Mainly it is present in children and pregnant women. They will eat chalk, sand, non-edible substance. They are having some cravings on non-edible substances. So this question may ask for 2 mark or filling the blanks like that they may ask. It is an eating disorder characterized by a persistent craving for non-food substances. So next condition is tics. Tics are sudden repetitive movement or sounds. The children may show some repetitive body movement, unwanted repetitive body movements and some unwanted sounds. They will show that repeatedly and they can't control that. This is what tics. Clear? Okay. The tics will be motor or vocal. Motor tics are body movements, unwanted body movements, and the vocal is unwanted sounds. Unwanted sounds. So the next section is health problems in adolescence. So what will be the health problems in adolescence? Health problems in adolescence. You can use the chat box also. Health problems in adolescence. Ma'am, any answers?
Ma'am, precocious
Yes,
puberty,
precocious puberty,
anorexia nervosa,
nervosa,
juvenile
juvenile
delinquency.
delinquencies. Yes, these are the main conditions. So, precocious puberty. So, what is precocious puberty? So, this precocious puberty is a condition where a child's body begins to develop and mature at an early age. The child's body begins to develop and mature at an early age. Typically, before mainly it is in 8 years in girls and 9 years in boys. Is that clear? Okay, that is precocious puberty. Next is the anorexia nervosa. Anorexia nervosa. It is an eating disorder characterized by distorted body image and an intense fear of gaining body weight. In the adolescence period, mainly the girls are having a fear of getting too much body weight and they start to eat less to maintain their body image. Okay, that is anorexia nervosa. So these are the questions, important questions from this unit. Health problems in infants, childhood and adolescent. So you can expect 5 mark questions and 2 mark questions from this section. So please be thorough with the definition of some important conditions like precocious puberty, anorexia nervosa. So like these conditions, you should know the definitions. Clear? Okay, shall we move to the next unit? Okay.
So your next unit is child with congenital disorders. It's a We can discuss some important topics from this unit. Okay, the first one is spina bifida. What is spina bifida? Spina bifida. It's an important question. Spina bifida.
Abna,
Any answers?
It's a condition where spinal cord is not completely fused.
Yes, good. Right answer. So, spina bifida is a congenital condition where the spine and spinal cord do not properly form during the fetal development. In the fetal development, the spine and spinal cord will not be properly formed. So, the child may have some physical disabilities, neurological disabilities, or orthopedic problems like paralysis, locomotion problems, neurological problems like seizures. That is spina bifida. The spine and spinal cord will not be properly formed during the fetal development. So, moving to the next topic, that is hydrocephalus. Ma'am, can you change the slide? Okay. You can see the hydrocephalus in the slide. So, what is hydrocephalus? Any answers?
Abnormal accumulation of the CSF in the intracranial spaces.
Very good. That's the right answer. So, hydrocephalus is a condition where there is an accumulation of cerebrospinal fluid in the brain, leading to increased pressure and potentially damaging the brain tissue. So, in the brain, the cerebrospinal fluid will be accumulated. The symptoms like headache, balance problems, and cognitive impairment will be present in the child. Moving to the next topic, that is cleft lip and cleft palate. So it is a condition that occurs when the tissue of the lip and palate do not properly fuse during the fetal development. In this condition, the tissue of lip and palate will not be fused. So the baby will have feeding problems, speech difficulties, and dental problems. Please note down the points. It's very important. Moving to the next topic, that is hernia. So what is hernia? Any answers?
Protrusion
Hernia.
of the organ.
umbilical hernia.
Yes,
Abnormal formation of
yes, yes.
muscles.
Yes, right answer. So hernia is the protrusion or bulge that occurs when an organ or tissue pushes through a weakened area in the muscle or connective tissue. Through the weakened areas in the muscle or connective tissue, the internal organs will be protruded. That is hernia. So there are some types like inguinal hernia, umbilical hernia, and hiatal hernia. So what is inguinal hernia? Inguinal hernia mainly occurs in the groin area when a part of intestine bulges through a weak spot in the abdomen. That is inguinal hernia. Next one is umbilical hernia. It occurs nearby the belly button. In the weak muscles near the belly button, the intestine will be protruded out. Next one is hiatal hernia. Occurs in the upper stomach. The weaker muscles in the diaphragm, the intestine will be protruded. That is hiatal hernia. Next, moving to the very important topic in this unit, that is TOF, tetralogy of Fallot. So, from the name itself, we can understand that it is a combination of four heart defects. Tetralogy of Fallot. Tetra means four. So, what are the conditions associated with TOF? conditions associated with TOF. It is already presented in the slide. Ma'am?
There are four conditions associated with TOF that are pulmonary stenosis, overriding of aorta, right ventricular hypertrophy, and ventricular septal defect.
Yes, ma'am. These are the four conditions associated with PRs. Once again, I will tell ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and overriding of aorta. Now we can discuss one by one. First one is ventricular septal defect. So, what is ventricular septal defect? It is an abnormal opening between the ventricles of the heart. There will be an abnormal opening between the right ventricle and left ventricle. So the mixing up of blood will be there. The deoxygenated blood and oxygenated blood will be mixed up. Next condition is pulmonary stenosis. In pulmonary stenosis, the pulmonary valve or the artery will be narrowed so that the blood flow will be reduced. That is pulmonary stenosis. The pulmonary artery will be narrowed so that blood flow to the lungs will be reduced. Next condition is right ventricular hypertrophy, the thickening of muscles of the right ventricle, which leads to the reduced heart function. The muscles in the right ventricles will become thickened so that heart function will be reduced. Next condition is overriding of aorta. The aorta will start from the VSD, allowing oxygen poor blood to flow directly into the aorta. The aorta. In the picture, you can see that the aorta is starting from the location of VSD, ventricular septal defect, so that the oxygen-less blood will be flow through the aorta. These are the four conditions associated with tetralogy of valve. Once again, I will tell you the conditions: ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and overriding of aorta. This is a very important topic. You can expect that for 5 months. So these are the important questions from this unit.
So moving to the next unit, that is children with various disorders and diseases. So in this unit, we are studying about some diseases that affect different systems, which include nephrotic syndrome, glomerulonephritis, pneumonia, Hirschsprung's disease, appendicitis, congenital cardiac failure, sickle cell anemia, neurological conditions like convulsive disorders, and some developmental problems like mental retardation and dyslexia, and also some locomotion problems like fracture, kyphosis, and lordosis. So let's discuss some important conditions. The first one is nephrotic syndrome. So what is nephrotic syndrome? Nephrotic syndrome. Any answers? Okay, the nephrotic syndrome, it is a kidney disorder characterized by excessive loss of protein in the urine. It is an kidney disorder characterized by excessive loss of protein in the urine, leading to low levels of protein in the blood and resulting in the swelling of various body parts. So this is nephrotic syndrome. The next condition is pneumonia. So in pneumonia, what happens in pneumonia? What is pneumonia? Any answers? What is pneumonia?
It is the inflammation of the lungs.
Yes, it is a serious and potential life-threatening infection that inflames the air sacs. It is the inflammation of the air sacs in the lungs. It causes difficulty in breathing. So it causes difficulty in breathing in the baby because of the infection in the air sacs of lungs. This is pneumonia. We can administer antibiotics and oxygen therapy is also provided for such patients. So next is the Hirschsprung's disease. It's an important question. This question may ask for 2 mark. So, Hirschsprung's disease. It is a congenital condition that affect the large intestine, mainly the colon. It causes problems with passing stool. It causes difficulty in passing stool. It occurs when the nerve that control the muscle in the colon are missing or do not function properly. It is a condition causing when the nerve that control the muscle in the colon are missing or not formed properly. So this condition is also called as absent colon. It is Hirschsprung's disease. So next is the sickle
Ma'am,
cell
ma'am,
anemia. What is sickle cell anemia?
excuse me, ma'am.
Do you want to repeat that?
Ma'am, repeat the topic.
Yes.
Ma'am,
Okay.
repeat the
So
topic.
that is Hirschsprung's. Okay, Lakshman, I will repeat. That is Hirschsprung's disease. Hirschsprung's disease. It is a congenital condition that affect the large intestine, mainly the colon, and causes problems with passing stool. Causes problems with passing stool. It occurs when the nerve that control the muscle in the colon are missing or not function properly. Is that clear?
Cleared, ma'am. Thank you.
Okay. Okay. So next is the sickle cell anemia. So what is sickle cell anemia? So sickle cell anemia, it is a genetic disorder which affect the production of hemoglobin. It affect the production of hemoglobin, which is characterized by the presence of abnormal HB molecule. Sickle cell anemia is a congenital condition. The presence of abnormal HB molecules are there. It causes premature breakdown of RBC. That is sickle cell anemia. Clear? So next is the condition dyslexia. Note that one, dyslexia. So dyslexia is a learning disorder that affect an individual's ability to read, write, and spell. So it is characterized by difficulty with reading and behavior of avoiding, and the child may show some changes in pronunciation. Clear? This is dyslexia. Dyslexia. So next is some locomotion disorder that include kyphosis, lordosis, and scoliosis. Kyphosis, lordosis, and scoliosis. The first one is kyphosis. Ma'am, next slide. So the first one is kyphosis. It is a spinal deformity characterized by an abnormal curvature of the upper back. You can see the kyphosis, the third picture. It is presented in the slide. The third picture, kyphosis. It is a spinal deformity characterized by an abnormal curvature of the upper back, resulting in a rounded appearance. Next is the lordosis. Lordosis is characterized by an abnormal inward curvature. It is an inward curvature of the lower back, resulting in hollow back appearance. So the third one is scoliosis. So it is the abnormal lateral curvature of the spine, resulting in a C or S shape. Clear? Clear? Okay. So these are the locomotion problems: kyphosis, lordosis, and scoliosis. Is that clear? Okay, this is about your this unit.
Okay, moving to the last unit, that is child welfare services. Child welfare services. In this unit, our focus is on child welfare agencies and some laws related to pediatrics. First, we can discuss about the agencies. The important one is ICDS. ICDS. So what's the full form of ICDS?
Integrated Child Development Services.
Yes, that's the right answer. Integrated Child Development Services. So it is a government program in India focusing on improving the health, nutrition and education of children under 5 years of age. So this agency provides some services like supplementary nutrition, immunization program, preschool education and educating the mothers of under 5 children. So ICDS will be a final question for you. Please note the question. Next, moving on to the laws related to pediatrics that include National Child Labor Policy, Juvenile Justice Act, internationally accepted rights of child, and adoption laws and services. These are the important laws in pediatrics. Once again, I will tell you National Child Labor Policy, Juvenile Justice Act, internationally accepted rights of the child, and adoption law and services. In the National Child Labor Policy, it aims to eliminate child labor and protect the children from exploitation. So, the child labor policy, it aims to eliminate the child labor and protect the children from exploitation. In the same way, Juvenile Justice Act aims to provide protection and rehabilitation to children in conflict with the law. There is a very important topic that is internationally accepted rights of the child. So, what are the rights of a child? Anyone? Any answers? Internationally accepted rights of the child. Okay. A right to identify, a right to freedom, a right to education, a right to social security, a right to health, a right to life, survival, and development. So these are the rights of the child. Once again, I will repeat a right to identity, a right to freedom, a right to education, a right to social security, a right to health, and a right to life, survival, and development. It is a probable question for the examination. So that's all about your entire syllabus. If you are having any doubts, you can ask now. Any doubts? Okay, then we can move on to the question paper discussion.
Okay, your question paper, your exam will be for 3 hours and the maximum mark will be 75. So in the first section, you are having 4 questions. The each question carries 1 mark. So that is the meaning of the following. There will be a word. You have to give the meaning. That each question carries 1 mark. In the second section, you are having filling the blanks. There is also you are having 4 questions. Each question contains 1 mark. There will be a sentence and a blank space. You have to fill the blank blank space with suitable answers. So next will be the short notes. There will be 5 questions. You have to answer any four. Each question carries 4 marks. Clear? And next is the answer the following type questions. Before answering the questions, you should check the mark distribution. Okay? And in the next adolescent disorders in infancy and disorders in childhood. No, you have to focus on that conditions and growth and development. Okay,
Yes, yes, ma'am.
that will
And
help you to score good marks.
ma'am, one more question. Ma'am, please tell me
Yes,
some important questions.
that is what we discussed in this 1 hour.
Ma'am,
Growth and development and the disorders in each and every age groups.
ma'am.
Okay, I think it's the time is over, and thank you everyone. All the best for your exams.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.